Although thousands of patients undergo blepharoplasty each year without complications, they certainly can and do occur. The rate and magnitude of these complications depend on the skill and experience of the surgeon, the technique utilized, tissue qualities of the patient, their compliance to postoperative orders, and the variability and unpredictability of healing, among others.
If you are watching this video, you may have already considered the alternatives to having a blepharoplasty or eyelid surgery. When applicable, these may include changing your present diet or beginning a new diet program, changing your exercise routines, or possibly addressing a current medical problem. Consideration can be given to the benefits of chemical peels, laser resurfacing, creams, injection or different fillers, or injectables in the skin, and various promoted techniques to tighten the skin. Blepharoplasty or eyelid surgery is an elective surgical procedure, and if you choose not to have it performed, you will avoid the risks associated with the procedure. You should consult with your physician about available alternatives other than blepharoplasty. Poor scarring is infrequent but could occur and could also be associated with changes in pigmentation or loss of some eyelashes. Occasionally, tiny white cysts or bumps can form within the healing suture line. However, these are generally treated very easily and are temporary. Close scrutiny of the eyes will reveal asymmetry in almost everyone. Usually, one eye is larger and is set back further than the other, and one brow is slightly higher. Because of this, your surgeon cannot make both eyes look exactly the same. Although more noticeable discrepancies are possible, they are unlikely. Infections can occur at any surgical site, but are usually rare with eyelid surgery. The undesirable consequences and complications of eyelid surgery usually result from removal of too much skin or too much fat. If too much skin is removed from the upper eyelids, it may be difficult or impossible to close your eyes completely, especially while you sleep. Removing excess skin from the lower lids can cause the same problems. The shape of the eye can also change to a more rounded appearance. Rarely, the lower lid can be pulled so low that it exposes the white part of your eye, which is called scleral show and is depicted here. A condition called an ectropion can occur of the lower lid, where the lid can actually turn outward away from the eye and become unstable. These problems can lead to chronic dryness, redness, and irritation of the eyes. Very rarely, these could further evolve into corneal ulcerations, which could ultimately cause changes in your vision. Revisional surgery such as canthopexy to tighten your lower lid might be required to address this possibly permanent problem. Your surgeon will be able to evaluate the tone of your lower lids and your individual risk factors for these problems. The removal of too much fat from the lower lid can leave your eyes looking sunken and more aged. A conservative approach of fat removal is generally a much wiser choice than a more aggressive one. Probably the worst and fortunately rarest problem is a pressurized collection of blood called a hematoma, which could develop under the skin and around the eye at the surgical site. This could lead to blindness if not treated quickly. Again, complications are infrequent, but do happen. The severe ones are fortunately the rarest. Other complications could occur, resulting in permanent deformities, the need for revisional surgery, and rarely hospitalization. Be sure to discuss these risks and possible related financial issues with your surgeon. The time it takes for the surgical procedure, as well as the postoperative instructions, varies greatly among surgeons and should be discussed in your consultation. Be sure to follow your doctor's postoperative instructions carefully. Eyelid surgery is safely and frequently performed under both local and general anesthesia. With a general anesthesia, you are completely asleep and your breathing is controlled by the anesthesia provider. Under a local anesthesia, usually you are sedated and the areas to be operated on are made numb with a series of injections. The recovery period also varies greatly depending on the technique, surgeon, and patient. Usually, bruising, if present, should be gone within 5 to 10 days. Makeup or glasses can be worn during that time to better conceal the area. Exercise or vigorous activity should be avoided for 3 to 4 weeks. Because of this shorter recovery period and the additive effects which enhance a facelift, it's often beneficial to do them together. Your surgeon will outline a unique recovery plan for you.
The next video segment follows the pre- and postoperative course of a patient who will undergo an upper and lower blepharoplasty.